Back pain is one of the most common complaints that drives people in to go seek medical attention and especially come and seek physical therapy. In fact, about 80% of people will experience low back pain in their lifetime. So ultimately, some of the boxes that we actually kind of have to put you in also are based on 4 different levels of sensitivities. And those are what I want to talk to you guys about right now. So one of them, the first one, is actually a movement preference or kind of a movement sensitivity. For some people, they just can't lean back, but everything else is fine. So you have a very clear kind of directional preference there. It's like, okay, again, I can move in one direction or I can move in all directions except this one. Number 2 is going to be a stasis sensitivity. This is more for people that are a little bit uncomfortable and we'd almost say like functionally unstable. It's not like they're necessarily broken and things are moving around too much, but they can't really tolerate sitting or standing or any one sideline or any one position for too long. And that is usually more indicative of somebody that really needs to strengthen and stabilize around their spine and learn how to use their body effectively. Number 3 is going to be a pain, like touch pressure sensitivity. So some people are just really hypersensitive to touch, and we're talking like light touch. That could be just sitting down and feeling the chair on your back or on your hip or something like that. And that hypersensitivity is it's something that we definitely have to be aware of. That nerve is lit up for some reason and it's just taking in way too much information and amplifying it for some reason. And the last one is load sensitivity. So if we think about our spine as like a bunch of stacked blocks, if I am lying down, there is really no vertical pressure on my spine as I'm lying like this. As soon as I get vertical, the weight of gravity is going to pull my body down on top of that. So that could be a load sensitivity. If you're like, oh, I just got to lie down, but as soon as I stand up, everything hurts. Or you could say, I feel pretty good. And then as soon as I pick up anything, it hurts. Again, 4 sensitivities: position, stasis, pressure, sensitivity, and load. And the thing is, you may not fit into any one category, and maybe you have 2 or 3 of those. No 2 back symptoms are exactly the same. Better relieve it. If you're not really sure and you'd like one of our therapists to go through that, this is what we do this stuff all day long, and this is how we approach movement and we approach trying to restore people's functional capacity. So reach out to our office and let's take a look and let's get you back.